when we get into treatment options, I want to make sure we have a chance to go over all the treatment options in the wide range. It's important you understand the full breadth of this. Always remember that option number one is to decline treatment options. You don't have to do anything. Doing nothing is an option. And so I want to make sure you realize I will respect your opinion if you decide to do nothing. Sometimes they'll say, I choose option one, and they'll remind me of that. But remember, just as I give you an option to do nothing, you need to give me an option to do nothing. Now, option number two is usually obtain further radiographic workup. X-rays, CTs, MRIs, EMGs, various things like that. And what I want to do on that is I want you to get a picture of that and have them put that all on a single disc. Bring the disc in with you because I want to look at it personally and go over it with you. That kind of objective information is very useful to help diagnose the problem, and oftentimes diagnostics leads to treatment. Now, option number three would be treat this physically. Many of you are youthful. You might be 90 years old, but you're youthful, and we want to use your body's assets to heal itself. And so physical could involve physical therapy, could involve chiropractic if you're so inclined, or osteopathic manipulation, which is what the DOs do, the doctors of osteopathy. We would also consider bracing, splinting, TENS units, acupuncture. All that would be within group number three. I'm going to talk more about the physical options in detail in another video. Now, option number four. Option number four is usually addressing the synovial joints, the facet joints, the zygapophyseal joints, or the sacroiliac joints. And what we're doing here is we're either injecting into the joint in the case of the sacroiliac joint, or we're numbing the nerves that go to the facet joints. Let's talk a little bit about the facet joints first, and that is a situation where we use a 6-hour numbing med to numb the nerve that goes to the joint. If you get dramatic complete relief, it'll only last 6 hours. This is just a test. If that's the case, then we go on and do it again to make sure it was a true response. And if you get great response, nearly complete response twice, then we burn that nerve, which can last a good year or two before it grows back. Now, on the sacroiliac joint, we put a needle into the joint and put steroid in it, which usually can break the cycle for weeks to months. There is work being done to numb and then burn the nerves to that joint, but it's not been standardized yet. Option number five is usually a treatment called epidural steroid injections, and epidural steroid injections are best for leg pain. They're best for arm pain. And we may talk about an intralaminar approach or a transforaminal approach. But at this point, epidural injections are for limb pain, or what's called appendicular pain. Now, option number six would be use medications that are not opiates. This form of treatment is a cover-up. It's being done to help you deal with the symptoms and cover them up while you do other treatments. And there's a number of non-opiate options we can use to try to address this. We always have to manage for side effects. We also have to adjust and change the dose to optimize its effect. Option number 7 would be a spinal cord stimulator. The spinal cord stimulator is our option where we place needles into the epidural space, slide up an electrode, and jam the pain signal electrically. Sometimes where you feel a little paresthesia, so you know it's working and what it's covering. Sometimes with a high frequency system, so you don't feel it, it just blocks the pain. Now, this is the second highest level of treatment we can get. It's not curing it, it's not fixing it, but it is blocking it. The next option we would have would be we would consider a discogram, where we place needles into the disc, various discs. We put dye in there under pressure to see if the disc leaks, and if the leaking disc reproduces the pain. Thus, we'll have found the pain problem. The next option would be to consider a referral to a big teaching institution, a tertiary center, Mayo Clinic, Cleveland Clinic, wherever you'd like to go in the world. The point of this is they can go through your case with a fine-tooth comb and see if we've missed something, or if you're a candidate for some sort of experimental treatment that we can't offer. The key here is that we don't want to be arrogant about this. We want to make sure that you have a right and you have a setup to get to wherever in the world you want to go. The next option would be consider a surgical option. Surgery can be very effective if you have leg pain. Surgery can be very effective if you have arm pain, and there's different types of surgery. Not being a surgeon, I won't go into in detail, other than the usual treatments are discectomies, where they cut away a piece of the disc, laminectomies, where they cut away a piece of the bone to give it more space. Sometimes they'll call that decompression, and sometimes they have to fuse, where they stop the movement at a joint. And all those types of treatments can be done in various cities. And we know various surgeons we can get you connected with, and then we work with you at managing that pain problem afterwards. One of the next options we would consider would be prolotherapy. Prolotherapy or ligamentous laxity treatments are little injections that are done into the ligament to cause it to tighten. You can almost think of it as spot welding. I don't do that. I have to use several of my colleagues to help me with that, but that's an option that we can get you connected to. Another option that's coming back again is a procedure called minimally invasive lumbar decompression, where we can put a needle on in the back and pull away part of the ligament that's causing some pinching or stenosis. And the last option would be use an opiate. Opiates can be very effective at covering up pain, and when properly managed can give very good pain relief and can help you return to function. But we need it to be able to help you return to function. And managing the side effects, managing the complications of that is challenging, but can be done. The point is, you always have options, and keep hope alive.